Hi. Do you guys know what is anemia? First, let's talk about normal red blood cell. RBCs is apparent as red. This is owing to the existence of hemoglobin. A completely developed human red blood cell appears as a biconcave, spherical, and dumbbell-shaped. To start off, here are the function of blood cells. First, transport oxygen. Second, transport carbon dioxide. Third, buffering action in blood. Fourth, in blood group. So that is about RBC. Anemia. Anemia is a condition in which you lack enough healthy red blood cells to carry adequate oxygen to your body's tissues. Having anemia, also referred to as low hemoglobin, can make you feel tired and weak.
Next, factors of regulation of erythropoiesis. Erythropoiesis is basically a process of producing red blood cell from bone marrow by the help of hormone called erythropoietin that's secreted by kidney. The relation between red blood cell produciton with iron deficiency anemia is that red blood cell need hemoglobin in it to help carry oxygen and give color to the cell. Iron is the one that produce hemoglobin, so that's why RBC process won't complete without iron, and will hemoglobin is like food coloring that give color to the red blood cell. It's not only give color but also have the ability to carry oxygen. Without hemoglobin in red blood cell component, the RBC can't carry oxygen by itself. This is how iron deficiency lead to hypoxia, low oxygen, condition, since it is part of the factor of erythropoiesis regulation. That's why erythropoiesis or RBC production and iron is important to our body, since it is crucial component to body cells, since without it our cells can't work properly.
In general, the etiology could be family history, chronic disease such as cancer, menstrual for women, iron deficiency, massive blood loss, metabolism of spleen and liver was impaired.
There are a number of potential etiology of iron deficiency anemia, which is included first, blood loss, for example, from the gastrointestinal or menstrual tracts. Next, an increased need for iron, hemolysis, malabsorption, etc., e.g., in pregnancy, lactation, periods of rapid growth in children. And other than the deficiency, anemia occurs when the body does not make enough hemoglobin because it does not have enough iron to do so, or because it is losing too much iron. A deficiency of iron in your daily diet. You receive iron from the food you eat on a regular basis. As a result of not getting enough iron, your body may become iron deficient. The body's inability to properly utilize iron. Lastly, pregnant women are more likely to suffer from iron deficiency anemia if they don't take iron supplements to help meet their own increasing blood volume as well as the growing fetus's need for hemoglobin.
Moving on, the pathophysiology of anemia. Anemia, in most cases, it begins with common causes, for example. First, reduced synthesis of hemoglobin. Secondly, the loss of blood, e.g., hemorrhage. Third, red blood cells, RBC, are being destroyed at an alarming pace. And it is one of the main consequences of this change. As a result, less oxygen can be delivered to the body as a whole. 2. Twice as much less oxygenation. In other words, oxygen will be in short supply to the body's tissues and organs. 3. Reduced brain oxygenation. Meaning, that person will experience headache and dizziness. 4. The muscles will get less oxygen. What will happen here is that there will be muscle that weakens, experiencing cramps, and exhausts. 5. The skin receives less oxygen. A bluish tint of the skin, as well as pallid and chilly skin, results.
Now, let's talk about investigation of anemia. Diagnose anemia. Your doctor is likely to ask you about your medical and family history, perform a physical exam, and run the following tests: complete blood count, CBC. A CBC is used to count the number of blood cells in a sample of your blood.
For the treatment and management of anemia, it depends on the type of anemia. First, aplastic anemia. Treatment for this anemia can include blood transfusions to boost levels of red blood cells. One might need a bone marrow transplant if their bone marrow can't make healthy blood cells. Treatment for this form of anemia usually involves taking iron supplements and changing your diet. For some people, this might involve receiving iron through a vein. If the cause of iron deficiency is loss of blood, other than from menstruation, the source of the bleeding must be located and the bleeding stopped. This might involve surgery. Managing hemolytic anemias includes avoiding suspect medications, treating infections and taking drugs that suppress the immune system, which could be attacking the red blood cells. Severe hemolytic anemia generally needs ongoing treatment. Next, treatment for folic acid and vitamin C deficiency involves dietary supplements and increasing these nutrients in your diet. If the digestive system has trouble absorbing vitamin B12 from the food, one might need vitamin B12 shots. At first, they might have the shots every other day. Eventually, they will need shots just once a month, possibly for life, depending on situation. For sickle cell anemia, treatment might include oxygen, pain relievers, and oral and intravenous fluids to reduce pain and prevent complications. Doctors might also recommend blood transfusions, folic acid supplements and antibiotics. A cancer drug called hydroxyurea, Droxia, Hydrea, Cyclose, also is used to treat sickle cell anemia. Do not seem to be life-threatening. It may be managed using a variety of methods, including lifestyle modifications, drugs for clinical manifestations, surgical intervention as a final measure, and the most helpful, being educated about it.